This project is focused on creating an efficient and effective hospital/ER, one that is unique as well as productive. We created this building in a video game called Minecraft. It revolves around using building blocks, and we did our best given the toolset that we decided on. We wanted to include as many essential elements of a regular hospital while capturing the feel and environment without restricting ourselves. Today, we are going to talk about the layout of our hospital as well as some features of our ER, as well as go through each patient's case and their route as they go through the hospital. The hospital features three separate sections: a center section, a left wing, as well as a right wing. Each section involves multiple rooms for doctors, being their office. Also rooms for professors to stay in hospital. Patient rooms, examination rooms, data rooms for record collection, and storage. We have a small waiting room in the entrance of the hospital with a service desk. The design of the road in front of the hospital is deliberate and necessary. The ambulance is able to drop off and load patients for efficient transport through the hospital. With three separate sections of the hospital, we are able to designate the patients and keep them from clashing with each other.
The first patient is patient 8, J.D. Thomas, a 31-year-old male disoriented after taking a hit in a football game and has no recollection of what happened. This patient is in need of emergency care. We will immediately take him to the back to get a head CT to see if the brain is swollen and or if there's any bleeding and see how bad it is. If it's a mild concussion and his head appears to be fine, he should stay overnight to see if he gets any other symptoms or if he starts to have seizures. And if in pain, we will start with the dose of acetaminophen, and if that doesn't work, we will give him a stronger medication like Narco. After a few hours, we will get him another head CT to see if anything has changed. The next day, he can be discharged, but we'll have to follow up with a neuro doctor to keep him in check. Concussions can be cured, but it's still necessary to go to the ER to check if there's any physical damage to the brain that will need immediate surgery. If it's just a regular concussion, the best people can do is sleep a lot and rest so the brain can heal by itself. And get the swelling down and drink painkillers like acetaminophen and or Morphine if they have any headaches.
Second patient is George Hampton. The patient is experiencing numbness in his left arm and a sudden onset headache, and this morning the patient began having trouble speaking. Triage will first try to find out what kind of problem the patient is having. Since the patient has a family history of heart diseases and showing symptoms of stroke, the staff will quickly do tests to see if the patient is having a stroke. This means that shortly after arriving, the patient will get a CT scan or another imaging test. The presence of a brain tumor or a drug response must also be ruled out by medical professionals as potential explanations of the patient's symptoms. The treatment depends on the type of stroke the patient is having. There are two types of strokes. Ischemic stroke. The blood flow to the brain needs to be immediately restored for an ischemic stroke to be treated. To do this, doctors may give emergency forward medicine to the patient. This medicine removes the cause of stroke quickly by dissolving the clot and might help people recover faster from a stroke, but the medicine must be administered within 4.5 hours from when symptoms first started. If 5 hours have passed since the symptoms, the patient should be taken into surgery. In the surgery, surgeons might use angioplasty and stenting, or a device called a stent retriever, to open up the blocked artery. Hemorrhagic stroke. The treatment focuses on controlling the bleeding and reducing the pressure in the brain. A surgery might be needed to remove the blood and relieve the pressure on the brain. In the surgery, the doctor might also repair the blood vessel that caused the problem. Third patient is Michael Billups. The patient complains of experiencing acute abdominal pain for the previous 24 hours. The patient reports minor discomfort in the legs joints. The patient, who is 15 years old, has sickle cell anemia. Over the previous 10 years, the patient has undergone multiple blood transfusions, the most recent of which was 4 months ago. He was given medicines for a urinary tract infection 2 weeks ago, but he only took them for 7 of the recommended 10 days. Sickle cell anemia is caused by a change in the gene that tells body to make the iron-rich compound in the blood red blood cells called hemoglobin. Hemoglobin enables red blood cells to carry oxygen from the lungs throughout the body. The hemoglobin associated with sickle cell anemia causes red blood cells to become rigid, sticky, and misshapen. The patient has a large number of sickle cells that got trapped in the spleen, causing it to enlarge and causing belly pain on the left side of the body. When the patient arrives at the ER, they get fluids through an IV, and sometimes red blood cell transfusions. If the blood count is very low, then we would have to do a blood infusion. If the patient has several episodes, we will have to do a splenectomy.